So I want to welcome everyone to our International Overdose Awareness Day panel discussion. I would like to begin by introducing our panelists, beginning with Dr. Jonathan Craig Allen, Medical Director of Rushford and Chief of Psychiatry at Midstate Medical Center. Dr. Allen will be providing information about the treatment services available at Rushford and across the system, highlighting the best medication-assisted treatment options for individuals with opiate use disorders. John Potter, the Clinical Program Manager of Meriden Opioid Referral and Recovery Program, also known as the MORE program. John has been with the program since the beginning and is here to share his experiences and knowledge and how this program has impacted the Meriden community. The program has been integral in linking clients to treatment services and providing overdose awareness, education, and support to clients and families to prevent overdoses. Lea Crown, Director of the Department of Health and Human Services for the City of Meriden. Lea is dedicated to ensuring that resources are disseminated and available to community members about opioid awareness and prevention, and ensuring that both individuals and families know where to obtain naloxone to continue to prevent overdoses. Finally, we have Julio Santos. Julio is a current client working with Rushford's MORE treatment program who has been successful in his recovery and who is here to share his experience with the treatment services he received from Rushford and this community. So let's begin by talking about what are some of the warning signs and symptoms that someone can look for to understand and identify that someone is overdosing.
All right, Christina, would you like me to take over?
Sure.
All right, excellent. So some of the warning signs and symptoms of an overdose, or how you can tell if someone's overdosing. I mean, first and foremost, what you're going to notice is somebody just being unresponsive or minimally responsive. They may have a blue or grayish looking color to their face. Especially the fingernails and their lips. There may be shallow breathing, or they're not going to be breathing at all. Their pupils may become pinpoint, so very small. They may experience some loud or uneven snoring or gurgling noises. And then there's other ways you can kind of tell if you're in the moment and they're on scene when this is happening. If you know that individual is known to use opioids, there may be markings on their body from intravenous drug administration, or there may even be syringes or pills or pill bottles nearby. Or you may be able to obtain information from bystanders that are there and that have maybe seen something that you haven't. So if you're ever unsure and there's Narcan present, it is okay to administer it as it's not harmful, but then you want to make sure that you call 911 immediately. And if you don't have Narcan, to absolutely call 911 immediately.
Thanks, Sean. All right. So what happens when first responders are contacted and find someone who has overdosed? What are the steps that are taken?
All right. Well, I can kind of speak a little bit on that behalf. If you come across somebody who's overdosed, kind of just, reiterating what I just had said. I mean, first and foremost, if you have Narcan, like I said it is safe to administer the Narcan. But then you want to make sure you call 911 immediately and get them en route to your location. And from there, you're going to listen to the 911 operator and just follow their instructions, possibly start some CPR, and just wait for first responders to come on scene. And then you're going to turn the situation over to them. And like I said, if you don't have Narcan, make sure you're calling 911 immediately to get first responders there. And that way, when they arrive on scene, they can administer Narcan themselves.
John, can you give some insight from what you've seen with the first responders, like them coming on, and how it works?
Absolutely. So typically, I can speak for the Meriden community. Typically, when 911 is called for an unresponsive body or person that is there, they will send fires and EMT, which is Hunter's Ambulance in Meriden, out to the scene. They're going to be the first responders. Oftentimes, the fire companies are strategically stationed around the city. So typically, they are your first responders. They are trained EMTs, and they will get there and they will administer Narcan themselves. And they'll also start the rescue breathing. And they have an apparatus for that, especially with COVID. They have a special breathing apparatus that they use to start the breathing. And then when the ambulance and EMTs get there, they'll transition everything to them and get them to a hospital as soon as possible.
Thanks, John. What ways can a family member or loved one support their significant other who may be struggling with opioid misuse or addiction?
I don't want to hog the floor. I can keep going. Is there anyone else that'd like to join in, or would you like me to keep going?
See, maybe Julio can chime in on this one.
Thank you.
Oh, so having some technical difficulties.
Yeah, maybe I should jump in.
Yeah, jump in for now, Dr. Allen.
Once we get Julio back, it'd be really great to hear from someone who has lived experience. But some of the things that you can do as a family member is to identify what services are available in the community, and even talking to your primary care doctor, certainly the local mental health authority here in the Meriden area. As you guys know, that's Rushford. And then meeting with and talking to your family member who is struggling, and trying to one of the things people often do is they may have that conversation alone, or they may bring other people with them that also know this person very well, and present themselves as being supportive rather than confrontational. It's not helpful to get into an argument. If we can't get Julio on right now, but I think we could bring John back, because one of the things John does on the street is work with people who might not initially be very interested in treatment at all. And so, John, you might have some suggestions for someone that's resistant and says, I'm not looking for treatment, I'm doing fine, even though the reason you're involved is because they'd overdosed.
Yes, absolutely. Thank you, Dr. Allen. I think when you're working with individuals who are, either reluctant for seeking help, or don't necessarily know that it's gotten to be a problematic at this point, I think some kind of key points to have are to listen first and foremost, and listening in a non-judgmental way. I think that's very important, to kind of just be there, support somebody, listen to them, not necessarily push them too hard. But try to kind of guide them, if you will, like Dr. Allen said, kind of knowing the resources that are available. So I think kind of having an education about the illness kind of changes things from being subjective to objective, if you will. And then I think just having an overall empathy for somebody and wanting to be there and help them. And like I said, I really just want to touch on that, being non-judgmental and being supportive of somebody through a tough time. And if you're kind of unsure as a family member or a loved one, there's support groups available for people, and they're free of cost. There's Smart Recovery, Friends and Family. There's Al-Anon. There's Nar-Anon. So there's resources available as well for family members. But I think listening is a key point.
That's great, John. That's what I was going to say, is that there are these places you can go, even if your family member or your friend isn't ready to get into treatment, but you can go and get support for yourself and get input and advice from other people that have been through it. Are we having any more luck with Julio being able to talk?
Julio, you okay?
Can you hear me?
Yes, we can.
Are you able to hear me?
Yep.
Yeah. All right. So my experience is like there's people, when you're in active addiction, you don't, what you're doing is wrong. You don't want to do it. So like if you're a loved one and you have a loved one that's in active addiction and you just don't know what to do about it, I think John had mentioned it, of being confrontational, or Dr. Allen had said it was instead of being confrontational about it, more like, hey, it's okay that you have a problem. It's okay. There's help, and I think that's really what it is. At the end of the day, there's, it's not the same. Like everything is changing. Like there's always there's always going to be drugs and alcohol out there, but if there's we could open up eyes to see that, you know, if there's less consumers, then there'd be less a problem. You know, it's just more like, it's killing people, and people talk about it and they put it out there, but I feel like nothing's really being done about it, or like what angle do we really go about it? So it's like, at the end of the day, it's helping people. Like, I didn't know what to do. I didn't know how to stop. You know, I every day was like, you know, it was a nightmare. It was like, oh man, you know, like I have to put narcotics in my body just to be able to function. You know, like I can't make breakfast right now. I haven't eaten in 2 days, but I can't make breakfast right now because I have an opiate addiction, and it's rough.
Julio, did you ever have a time where you had family member or friends try to get you to get help?
Yeah, everyone wanted me to get help. It was more like a self thing, like, because it didn't matter who wanted me to get help. Like, I didn't care. You know what I mean? So I was an individual at that time. You know, like I didn't want to be alive. You know, and I feel like a lot of times we feel like alienated because we're in this bubble of addiction. So we feel like everyone's against us. We feel like the people that we love the most, you know, we're the victim, not them. You know, we're not paying attention to really, we're not seeing the damage that we're doing to others. You know, we're looking at, you know, addicts, when in active addiction, look at it like, well, you know, I'm doing it to myself. And we, you know, at that moment, we think we're only hurting ourselves.
Okay. You gave a suggestion earlier, but I'm going to ask again. So what would you say if I was concerned about my kid, okay, and they have a substance use problem, they have a drug problem, and I really want to help them. What could I do that would be most helpful from your perspective?
I feel like maybe letting them know that it's okay to talk about it with you. You know, have more open discussions, because the problem is the stigma. It's like the elephant in the room. Nobody wants to talk about, okay, like for me, everyone knew I had a problem, but nobody talked about it. You know, nobody talked about the problem, but that's part of the problem right there. It's not being talked about enough.
Right.
And I feel like communication between a loved one and another, because essentially sorry, I lost train of thought.
I think that's great advice, Julio. Opening up the conversation. I'm willing to talk to you about it. It's okay with me if you have a problem. Let's talk about it. I'm not going to be critical. I'm not going to jump down your throat. But I'm here and I really want to help you. And I'm worried about you. So, that's sounds like what you're saying.
Yeah, and kind of try to see where the individual's head is at. You know what I mean? Some people are always in different stages, mentally and emotionally, and wherever they are in there, whether they're in active addiction or in recovery. Yeah. So it's like, it's just. Sorry?
Oh, I just said well said.
Thank you.
Okay. So this one's more like, I think, geared towards Lea, but where can community members find information about overdose risk and prevention?
Sure, thank you. And thank you, Julio, for sharing your story. I really appreciate it. So as far as resources, the health department does have a pretty comprehensive and extensive website with materials available in English and Spanish on overdose risk, prevention, treatment, and recovery. People can also go on a lot of the state websites, such as the Department of Mental Health and Addiction Services. But what I really like, and I have a show and tell, is the NORA app. So for information on the go, I would really recommend downloading this app, and it stands for naloxone and opioid response. I don't know if people could see that. It's probably backwards. But this app has information on signs of an overdose, step-by-step information on how to respond to an overdose, how to give naloxone, all of your legal protections under the Good Samaritan Act, and also where to find naloxone if you just enter in your zip code. So the app is also available in multiple languages, including English, Spanish, Polish, and Portuguese. So this is a really good sort of on the go. It's very picture-based, very easy to understand. Also, all of our first responders.
Can you give us the name of it again, Leah?
Oh, sure. NORA, N-O-R-A, and it's the naloxone and opioid response. So you can actually download it from the app store, or you can download it from the Connecticut Department of Mental Health and Addiction Services website. Very easy to do. If I could do it, if I can download it, anybody can download it because I'm not technologically advanced. Also, these cards right here. It's a trifold. All of our first responders have these. So Meriden Police, Fire, and Hunters. This one is titled "Someone You Care About Has Survived an Opioid Overdose." So when out in the field, somebody is actively overdosing, this is actually provided to either family members or if they go out to a house. It has all sorts of information about what are opioids, what is naloxone, and then when you open it up, it has actually all of the locations in Meriden where pharmacies that prescribe naloxone are, a lot of resources locally with phone numbers, and then a lot of helplines and all of your community partnerships and substance abuse assessment centers right here. And these are also available English and Spanish for all of our first responders.
Do the police carry those and give those out sometimes?
Yes, all of the police departments, they don't have them, we have lots and they should have them. I'm sorry?
Give those out, John?
Yes, we do. We have them here and we give them to our clients as well.
Cool. We have a new guest.
We do. So this is Roberto Rosado. He's the police chief of the city of Meriden, who's demonstrated a significant commitment to this cause as well. How you doing, Roberto?
How we doing?
All right. So Leah, you were also mentioning naloxone or Narcan. So I was that was actually the next question is how can people, or what is Narcan, and then when is it used and how does it work?
Sure. So I'll let Dr. Allen answer because I know I've heard him talk about what it is and how it works with the receptors, and I think he'd do a really good job answering that.
Sure. Yeah, so what naloxone is the opioid overdose reversal medication. And so what happens when you take opioids is they bind to these receptors in your brain, these mu receptors. And these receptors are in all different parts of the brain. They're in parts of the brain that control pain. They're in the parts of the brain that control pleasure. So people get high when they take these sometimes. But unfortunately, they're also in the part of the brain that controls your breathing. And so when people have an overdose, the part of their brain and the brain stem that controls breathing is overwhelmed with this drug. And what naloxone does, it binds that receptor tighter than the opioids do. So if you get enough of it in your system, it'll knock those opioids off the receptor, most importantly, in the part of your brain that controls your breathing, and you'll wake up. And you'll be alive. You might not be very happy because you probably don't remember what happened to you, but you're alive.
Julio, did you want to speak to the experience of that going through that on the receiving end? Oh, I think we're having technical issues again.
Can't hear Julio right now.
Can you hear me?
Oh, there
yeah.
we go.
Julio, you've gotten naloxone before?
Yeah. So naloxone, I overdosed. I was unresponsive to the first dose of naloxone. They did the nasal naloxone, 1 through 1 nostril, and I guess I was unresponsive to it, so they gave me naloxone through IV, and I guess I came to. I always carry. Hear me?
It's breaking up a little, but keep trying, dude.
So,
I wanted to hear this.
I know.
yeah. So I always carry naloxone with. Yeah, and I keep putting in the car in the house. Like I actually use them.
All right. Hold on. I think we're gonna have to wait a second for that. So why don't so let's talk about where people can get naloxone, and then we'll go back to Julio.
Sure. So luckily, naloxone through various legislation is really easy to get in Connecticut. We're very fortunate. And it's easy to get in Meriden. So most people know naloxone as Narcan, right? That's the brand name of the nasal spray that Dr. Allen just held up, which is a form of naloxone. And people can get naloxone in Connecticut and Meriden through a variety of methods. One, their primary care provider or their family doctor can actually prescribe the individual naloxone, and then that can be filled at any Connecticut pharmacy. Any provider that prescribes opioids can also provide naloxone. Pharmacists that have completed training to become certified can both prescribe and dispense naloxone. And in Meriden, there are 12 locations that are located on the inside of that form that I showed before, and this is also on our website. People can also just call info line 211 for locations. Or through Rushford and the Meriden Healthy Youth Coalition and my office, we hold a lot of virtual Narcan trainings. So because of the COVID-19 pandemic, since we can't have trainings face-to-face, we do them virtually, such as this, like a Zoom. And then what we do for everybody that sits through the training, we actually hand deliver the Narcan kits to their house. So we'll do a contactless delivery service. So we provide them with the Narcan kit and a lot of other education and prevention materials along, such as medication disposal bags or timer caps for prescription bottles that actually time when they were opened. If people are interested and they're viewing this and they're not in Meriden, they can actually go on the State of Connecticut website, the Department of Mental Health and Addiction Services, type in their zip code where it says find Narcan, and all of the pharmacies that are able to dispense will be listed. And then I just wanted to mention too that Connecticut Medicaid and most commercial insurances do cover naloxone, although there may be a copay or deductible.
Rushford also does have a fund specifically for that as well, so we can work with the folks that maybe their insurance doesn't cover it, so we do have that as well.
Excellent.
I should just mention too, if anybody takes the training through Rushford or Meriden Healthy Youth Coalition or my office, it's free. So the training is free and the Narcan is free.
That's great to know. With a prescription, it's not free. Unless your insurance, if your insurance covers it, it's free. You could possibly have a copay, but it's great to know where you can get it if you don't have the money for that.
Mm-hmm.
I was wondering, can I actually share too? Because I've gone, as a walk into a pharmacy in Meriden, and had a good experience. Kind of just sharing how to go if you don't have a prescription and how to obtain it. Because just kind of adding to what Lea said, I mean, getting Narcan is relatively easy. It is typically a prescription and it does bill through your insurance, but if you don't have a prescription for it, you can actually go to a local pharmacy as a walk-in. So the best way would be to kind of call your pharmacy beforehand just to make sure that they have the Narcan in stock, and to also confirm that they have a trained pharmacist on site who can dispense it. But from there, you can actually just walk into the pharmacy for the script. And if you do have a medication provider, clinician, or pharmacist, just ask them for a Narcan, or I should say naloxone prescription. And it, like I said, it's relatively easy, but they will bill through your insurance. A lot of insurances do cover the copay, and sometimes there are small additional copays. But like Christina was saying, Rushford does have some ways to kind of assist people for those financial concerns.
All right, so next we'll move to, can you describe the scope of the epidemic in Connecticut and how specifically it has been affecting this community, the Meriden community?
Sure. So I hate to be data heavy.
It's okay.
But I did pull up some statistics. Oh, I see we got Julio back, hopefully. So over the past 18 months, the state of Connecticut really has made strides in order to provide local health departments with more real-time data in order to address the opioid epidemic. So what we use currently at the health department are 3 different methods to get the data and then be able to pass that data along to our community partners so that way we can plan interventions as necessary. So the first one is we use data sets and reports from the Office of the Chief Medical Examiner and also the Connecticut Department of Public Health. The Office of Injury Prevention puts out some really great monthly reports for us, as well as some nice data maps that we can get some visuals. The second one that we use is an application called ODMAP, which stands for Overdose Detection Mapping Application Program. It's actually a product from the Washington, Baltimore high intensity drug trafficking area. There's a lot of acronyms that go along with that. But what happens is EMS personnel call overdoses into the Connecticut Poison Control Center. The Poison Control Center then enters that data into this ODMAP, and local health then is able to look up the data, and it's usually 24 hours in real time to see where are the overdoses happening, was naloxone used, was there a fatality, and a bunch of other different information. The last one that we use is a Connecticut Department of Public Health program called Epicenter, which accesses near real-time, non-identifiable emergency room data for situational awareness. As far as the scope, what's happening in the state and in Meriden, in 2019, Connecticut saw 1,200 residents die of accidental opioid overdose, which was an 18% increase from 2018. In 2019, Meriden had 23 residents die from accidental overdose, which was a significant decrease from 2018. And we hope that our programs such as MORE and the partnership that the city has is really making a great impact. Actually, just either it was yesterday or the day before, Connecticut DPH came out with a weekly report that as of mid-July of this year, there have been 666 confirmed overdose deaths. Which is a little bit more than last year. And there are actually 336 pending cases that may be added onto that number. So we're seeing a lot and we're not quite sure why. We don't know if COVID-19 is related to it, with just the anxiety that people are feeling and just the uncertainty of what's going to happen. This same data set from the Office of the Chief Medical Examiner, portion of it actually showed that so far this year, and this was as of 3 days ago, Meriden has had 19 residents die from accidental overdose, which is a little bit higher than last year. 14 of those are male, 5 female, 9 white, 2 black, and 8 Hispanic. So we're going to be watching this closely. I know that our programs and partnerships are really looking at this almost on a weekly basis. Every time I get spike alerts for the county level on ODMAP, I know I'm taking screenshots and sending them to John and other community partners to say, hey, what is going on? What are we seeing in Meriden? And I don't know if the chief can add anything extra about what his staff are seeing out in the field.
I'm sorry.
Oh, go ahead.
No, I could talk to staff and talk to them about statistics. We could include those in a quarterly report to the city. That way, all of you could receive that as well. I'm coming in new to this, so whatever you need from me for stats or any other information, even a partnership, you know, I'm committed to that. So whatever you need from me, I'll certainly get it done.
Okay, thank you. Julio, I know you got back on. Did you want to talk about, we did want to hear your experience with naloxone and what you were going to share.
Yeah, can you hear me?
Yes, we can.
Sweet. Sorry about that. So my experience with naloxone, it saved my life. Yeah, pretty much. You know, like I'm grateful. It's a miracle thing that exists. I'm like, I remember taking it, and like even with Suboxone, you know, like when the opiate goes to your receptor and then the naloxone, like it literally, like, it rips it out right out of your receptors and you go into instant withdrawals, like a pain and like you feel like you're gonna die, but you don't. And it sucks, but it's worth it. I don't care. The pain is nothing. Like I'm alive. You know what I mean? And I'm grateful for that. I keep one. It's funny. I say that. I don't know if you guys can see me, but I actually have Narcan in my hand. I keep it in my car. I keep it everywhere. I've used it on people, and now I always keep them with me because like it's to that point. It's really that big of a problem. Like I don't, and it's to the point where you have to have Narcan everywhere now, because if you don't, it's like it just doesn't make sense. It's like, you know, it's like COVID without oxygen. You know what I mean? And without those machines, without the respirators, it's just you need them. And like, yeah, I wouldn't be here. I wouldn't be here today if it wasn't for naloxone. You know, it's yeah.
Thanks, Julio. All right, so we'll go to the next one, which I think both Julio and Dr. Allen can speak to. And John, what treatment options are available for the community for someone struggling with opiate addiction? So what services does Rushford offer?
You know, I can start by talking about the services that Rushford offers, and then John could chime in with how he connects to different services. And then, you know, I'd be interested to hear what Julio went through and what services, you know, how he got connected and where he went and so forth. But with Rushford, along with a prevention department, which is very active out in the community, we have outpatient services. So some people that might come here once a week or even less frequently. We have more intensive services, which can be multiple times a week. And then services that are designed to keep people out of residential program or out of the hospital. And if someone does need more structure than that, we do. Over in Middletown, we have a residential treatment program so people can go and have withdrawal symptoms managed. And it's a withdrawal management facility. People know those facilities as detox. And then we have a longer term facility, which is our residential treatment facility. We have a men's floor and a women's floor. And there is also an extended care facility, which is across the river in Portland, which is another 3 or 4 months, and then relapse prevention. So we have the full line of services, and we've been able to work with organizations, first responders, emergency departments, and with programs like the one that John is involved with the city of Meriden. John can tell us about how you connect to programs. What programs do you guys use?
Absolutely. Thank you, Dr. Allen. So actually, the MORE program is essentially a community support program based out of the crisis department here at Rushford Meriden. So what we offer is we have a clinician, and we also have recovery support specialists who assist with case management. So what the clinician does is they go out into the community and meet with individuals who just overdosed or had a suspected overdose, and they offer their recommendations based on what the individual may need, whether that's a withdrawal management program or inpatient program, or like Dr. Allen was saying, an outpatient program to prevent any further or more intensive care. And then we also do discuss medication-assisted treatment for not only opioid use disorders, but also often alcohol use disorders as well.
And that's essential for someone who's got an opioid use disorder, John. Using medication-assisted treatment is the first-line treatment. It decreases risk of overdose death by over 50%. Some studies have shown close to 80%. So that is one thing that we can do, and that's using medications that are buprenorphine-based. One of them that people know about is Suboxone. Also, it could involve using methadone, which you get from a methadone dispensary, or a different kind of medication, which is called naltrexone, a little bit different than naloxone, and it's an extended release medication, an injection once a month. any of those 3 FDA-approved medications for opioid use disorder can help to keep people alive who have an opioid use disorder.
Absolutely, and the MORE program connects, those individuals looking for medication-assisted treatment to our local facilities, and then the recovery support aspect, the case management assists the individuals with more of their basic and social needs, such as food, shelter, clothing, and even employment services. So trying to kind of help people like the whole body healthcare approach and taking a holistic approach to recovery.
Yeah. You hear me?
Yep.
Yeah.
Can I say something?
Yeah,
Sorry.
absolutely.
No, so yeah, like I went through pretty much like almost all Rushford programs. They have like everything to whatever kind of help you need. Like everyone's at different points in their life and their recovery. Like they have the IOP, they have the inpatient residential, PHP. There's like all those different levels. I went through them and like they were necessary. So like it worked out good because I had, according to what I needed, especially with the MORE program and with Rushford, it's just been there for me the whole way. Even going to Stonehaven. I went to Stonehaven for 3 months. I love Rushford. Rushford through my life. They took good care of me. And I just, I would recommend it because every time, every time I was out there and I was messed up and I wanted to go to jail or I was whatever it was, I was sicker and I needed help. I needed help. I didn't have nowhere to go. I didn't have nothing to do. I had a dollar in my pocket and dope sick on the corner, and Rushford took me and helped me and was like, you know what? We're gonna do something about this. How can we help you? And I work very closely with John, Christina, and it's been amazing. Like I thank God for putting in my life. It's been a ride, and now I have such a good network for my recovery. Because,
Julio, how did you get involved with MORE in the first place? How did you get involved with MORE?
Okay, so I got involved with MORE because I pretty much died, right? I overdosed. I was at work and I overdosed in front of my job right when I was about to clock in. I had an injured foot and I couldn't make it through that shift. I knew that if I didn't work, I was gonna get fired. I had a lot of pain in my foot. I did one bag of fentanyl. I didn't know it was fentanyl. I didn't know what it was. Nowadays, it's all that. And I overdosed in front of my job, and I wake up to paramedics, police department surrounding me, and an officer comes up to me and tells me, he's like, "Hey," he's like, "You're lucky to be alive right now, bro." And that was an eye opener. So I knew I needed to do something. I needed help, and John Potter was there. That's my guy right there. I love John Potter. And when I woke up in the hospital, he was the first person I seen. And we talked, and I told him a little bit about what's going on, and I told him, everything, what's going on with me, what it is, because it's hard. It's hard to one, be in recovery, focus on recovery, and maintain a normal life as a successful working citizen, like a normal person, whatever normal is.
That's a great story.
Yeah, I was gonna say, just to kind of add, not much to that, but that's part of the benefits of the MORE program is, we received the referral for Julio, and I was in the hospital shortly after, and able to kind of be there in a very vulnerable time for him, and offer him support, and just his willingness to say, I need help, was kind of what made this work out perfectly. So I'm just.
John, who gave you the referral? Was it Chief Rosado's group, or was it the EMS or fire?
You know, Dr. Allen, I don't recall offhand, but it was one of the first responder agencies, and they got it to me in such a timely manner that I was able to actually get to the hospital to see Julio while he was still there. So I think that's just kind of everybody working well together, and then ultimately Julio's decision to allow us to help.
Yeah.
Sorry, I sat still for too long and my lights went out. I'm so into all these stories. I should also mention too, as part of the MORE program on the prevention end, is that this is a grant-funded program and it allows us to purchase 400 naloxone kits, or actually the Narcan kits, annually for our first responders, which is huge. We also take some of those kits and then provide them to community members through our trainings. We also have been doing a lot of trainings for our community and for our first responders, such as mental health first aid, QPR, which is question, persuade, and refer for suicide prevention awareness. There it is. That's it. That's what we give out. Yep, that kit. And then any other trainings that our officers may need to work with those who are experiencing substance use disorder. So it's a fantastic program. It's a 4-year grant. We're just finishing up our 2nd year, and it's been wildly successful.
Absolutely. You're showing it, Julio. Do you want to say anything else? Oh, that's a perfect spot to stop.
That's a good way to freeze.
Right? Perfect way to freeze. All right, guys. Well, that's all the questions that I had. I don't know if anybody want to add any last thoughts before we wrap up.
Well, you know, I wanted to ask, you know, the chief says he's new, fairly new, what his thoughts are about this program and the Meriden community and substance use disorder in this community. If you had any thoughts, I'm putting you in the hot seat.
You put me on the spot, but that's okay. So I'm actually glad that you're doing this, because in Willimantic, this is one of the things that we were missing. We had a big population in Willimantic that needed this assistance. So coming here is one of the things I thought of that we need to improve on in law enforcement. And then the MORE grant has certainly helped us. Our officers have already gone out with John a couple of times. And actually, I thought the officers would be a little against it, but I've seen them be more positive for it. You know, you just don't know how they're going to take this. And it's a different way of doing police work. It's certainly an effective way of doing police work. So I do enjoy this. This is one of my thoughts coming in, is to provide more social work help to our community through law enforcement. So certainly referrals for me is a way to go. So certainly if we could help out in any way and make referrals and make our jobs all easier, we'll certainly do that. We don't want individuals hitting rock bottom before they get assistance. So if we could intervene ahead of time, I think that's a win-win situation for all of us.
Yeah, great. Absolutely. I think it makes a big difference to have all of us working together as opposed to separately in silos. So it makes a huge difference.
Absolutely.
Thank you.
And thanks for getting me involved.
Anytime. All right, guys. Anything else? No?
I was gonna just very quickly, just one more thing I kind of wanted to add about MORE. I do think it's important to kind of get out there, is I do want to say that part of our team, we do offer a bilingual recovery support specialist. You know, primarily due to Meriden's large Spanish-speaking population, but also Rushford offers Spanish-speaking programming as well. I just wanted to get that information out there. I do think that's very important. And I also want people to know that our program does work with family members, with friends, with spouses, neighbors, also different local, you know, Meriden companies on Narcan education, and then also the safe medication disposal aspect. If there's anybody that wants to learn how to use Narcan or how to properly dispose of unused or unwanted medication, they are more than welcome to contact me directly, and I'll walk them through it.
Thanks, John. That was very important. We do have a huge bilingual population here in Meriden, so they do need to know we have those services. Thank you. All right, guys. Well, we're going to wrap up, but I just wanted to thank everyone who participated. I think this went really, really well and got some really good information out there, both from us as providers and community members, as well as from Julio, who has also had his long lived experience. So Hopefully with that we can send.
For
Oh, go ahead,
putting this
Dr.
together, putting all this together, Christina.
Thank
Thanks
you.
for you. So you pulled the team together, but this was great. It's important information and getting it all out there.
Thanks, Dr. Ellen. I appreciate that. So I know we've definitely sent the message, but recovery is definitely possible, and we want to highlight the hallmark of our events this year is to identify that we want to end the stigma and the shame and help people really seek recovery if that's what they're looking to do. So reach out if you need any support. All right, we'll wrap up. Thanks, everyone.